why are we stuck, with lytics as a class one, and how can we invert the guidelines? I mean, what's it going to take?
Yeah, I think, Flame, I think it'll be argued it's not a randomized controlled trial. So how does that influence the exact level of evidence and the guidelines, et cetera, et cetera? But again, Flame has another key takeaway. And of course, it sounds like I'm being a dead horse given my talk before, but I think Flame clearly calls into question the algorithmic preference for systemic thrombolysis in the massive P population. You can tell when you let experts make decisions instead of putting them in an algorithmic box with these guidelines, that they can make some pretty darn good decisions in some patients who can get great outcomes. So I would argue that this does call into question that position of primacy, the level one recommendation for high risk P systemic thrombolysis. As far as how you move things forward, I mean, let's keep in mind that what got the guidelines looking how they are right now are still at levels of evidence that are largely based on expert opinion and non-randomized study. So we still are adding what's been added with Flame is comparable or superior to that type of evidence. So I think it should be taken very seriously. And I think it should, obviously, my opinion on it, if I was a guideline writer, it would be that we should start to ask ourselves, where does embolectomy fall into this rubric? And let's learn the lessons of Flame, learn how patients were selected, learn about PERTs, and write the guideline exactly based on what we've observed, because it was an important observational study. We observed something that should influence guidelines.